a policy analyst. I work with the Kenya Institute for Public Policy Research and Analysis, that is KIPRA. KIPRA is a State Department policy think tank established by the government of Kenya under the State Department for Economic Planning, and we support a government in public policy making through evidence-based research, and that's one of the main mandate and objective for KIPRA, though we also support in many other issues, more so in technical capacity building in public policy making for the government as well as also for the private sector and so forth. So I'll just mention only those a few mandates that KIPRA has in terms of public policy making space. Thank you.
Thank you so much. Thank you, gentlemen. Why do you think data literacy is important, and how can it be used to achieve the SDGs? We'll start with you, Elijah.
How I understand it, how to think about it first is what are SDGs?
Yeah.
So these are sustainable development goals, which range from issues to do with how we can eradicate poverty in the world, how we can make the world livable through climate action, issues to do with social economic activities, issues to do with education. How do you provide education, equity or equality, gender equality or whatever kind of equality. So all these 17 SDGs that are globally been accepted, that this is the Agenda 2030. This is where the world wants to get to in this near future. Then the other way to think about it is also, other than the part SDG, there is also data literacy. Yeah. What is data literacy and how is it important in connecting the two? So for me, data literacy is actually the ability to be able to collect data, analyze that data, interpret it, and use it to make informed decisions. Now back to your question, how is this data important in ensuring that we arrive to our SDGs or Agenda 2030, and specifically at devolved level, county levels? So at UDA, you know, we are a political party, so we do have politics to manage, which is essentially the sentimental part of government. You know, government has different sections, and for us, ours is purely managing sentiments of Kenyans and ensuring that we get re-elected. So the responsibility is quite huge, and that is why what we've done as a party is to support government in ensuring that we communicate what we are doing, and from a political perspective. There's a lot that goes into it. There's propaganda. There are alternative data that comes out. So in anything that we do as government, we'll always be countered by alternative data. And unfortunately, it looks like it's much more easier to provide inaccurate or propaganda than actually to report accurate data. And why that is because human beings really love to listen to innuendos, propaganda, and things that are good to hear. So sometimes it's quite challenging. I would take a very good example of some of the things that are devolved, like healthcare. So in healthcare, all of us know about SHA. Yeah. That most of them are said, it's SHE, it's SHA, what is it? So what the spirit in the act was to make sure that everyone is covered, number one, and number two, it becomes significant in such a way that we can be able to afford to actually provide it. Because NHIF was good, but the challenges that was there was one, there were so many issues with tracking what government should pay or what NHIF should pay. And we had about 70% only being correct claims. The rest, 30 to 40%, were fraudulent claims. People with no hospitals or people registered as healthcare practitioners, but they actually were not there physically providing. And that data has been available. And even when you look at UDA platforms, we've been providing that. So what SHA was to come and do is to make sure that we protect what Kenyans are contributing, expand it, and actually be able to account for it. And that is why the use of software. So the challenges that has come are just challenges that are hitting the issues to do with software. So what we did is we agreed with counties and made sure that we have one system that is running across and one system of medication. So you have to go to the county hospitals, dispensaries for you to be referred up all the way to the referral hospitals and finally to the main referral hospitals, which is KNH. So that 5-tier hospital kind of framework was to make sure that we only use resources at the right step. So data has been quite useful because you're able to map all the families, all the people that need support or need to be part of SHA. And we've been targeting them. We've been sending reports to county government, telling them what percentage they are in registering people to SHA. And I'm sure you've seen, we've been able to even rate counties and say this is the county that is most registered, this is the county that is not. So that's how we are using data to make sure that eventually we reach to every homestead and establish those people to get registered so that they can be able now to enjoy the services. Thank you.
Paul, I'd like to ask you, how do you think when it comes to data and policy making, you realize that for policies to be made, it has to come from data. But how then can we translate that data to be able to enable us to accelerate the SDGs or be embedded within some of the SDGs to be able to see what achievements we've made and what achievements have we not made? And is there any activity towards that happening?
And from my experience, I have interacted with the various data sets, most of those provided by KNBS, in undertaking my policy research. And I can say that really through that research that we undertake, we are able to inform government on various aspects, and more so I've seen quite a lot of improvement in the areas of education in terms of key milestones, key indicators in education, as well as also in health, which have been achieved. I know we also have institutions in this country that just their work is just to track the SDGs in terms of where are we, what are we achieved so far, and so they do that utilizing the data that have been collected over time. And so I think from what I've interacted with them, I think we are, as a country, I think we are doing good in some of the indicators that we are interested in measuring, touching on various goals of SDGs, more so when you look at the poverty, on education, on health, as well as also on climate change. And government has really done a lot in terms of trying to achieve those particular SDG goals in those key areas. So data is very important and very key. And as the government maybe keeps on relying on data to make informed choices, the key important thing is to ensure we have quality data in terms of which is timely, as well as also in terms of accessibility, that we can, it's accessible by various entities and institutions.
So would you have any information regarding which SDG is doing much better? I know you've spoken about basically doing data for the government and their organizations tracking the SDGs, but would you have any information of which SDG has been really improved upon when it comes to Kenya as a country, and which ones are those lagging behind? Would you have that information?
Maybe the data I've interacted with, that is KDHS 2022, that is data that's collected by KNBS, which I've utilized for quite some times in undertaking policy research, and there are quite some kind of improvement in terms of various health-related indicators, like under 5 mortality rates, maternal rates, as well as also access to delivery by a skilled personnel. And bear in mind that devolution is taking place, and some of the key milestones that devolution has really maybe tried to achieve is in the areas of health is reducing those mortalities, reducing in terms of access to skilled deliverers. Some countries maybe more so when you look at counties like Turkana, Marsabit, Wajir, there are quite a number of improvement when it comes to access to health, more so those key indicators that I mentioned towards health. Even in terms of vaccination, as a key indicator in health, there are quite some kind of improvement across counties on that aspect. So that's why I say. And when it comes to literacy level, I think we are doing better as a country. They are due to quite a number of investment that have been made into the education system, and with the data set that we have been collected over time, there are quite some kind of in terms of students, teachers, population ratio. Thank you.
Okay, thank you for that, Paul. So what are the gaps when it comes to data literacy and policy making? What are some of those gaps?
Afternoon, I'm Jeffrey Ojijo. Last year in November 2024, all stakeholders of SDGs were in Mombasa. And one issue which was discussed a lot was the issue of data accountability. And there were areas which were being touched. One, the sources of this data, and also integration of this data to the national policy, and also to the data landscape. I want to give you two examples to localize what I'm talking about. One, in Tanzania, there's one organization which decided to construct boreholes to address access to water, access to water. But out of the 6 boreholes, it was eventually realized only one borehole was active, 5 were not working. When they did further investigation, they realized that women opted to go to the river to mitigate gender issues rather than taking the water. So in terms of their data, who cheated the other one? Was it the organization who constructed the boreholes? Or those people who realized the boreholes were not effective, so that these women are going to mitigate their gender issues? What is happening is that we are lacking some capacities even at the county level to address the data issues. If you look at all these county governments, you might find that out of the 47 counties, only 3 counties have developed county statistical data. This is the key source of our data for the VNR reporting. Now, this answers the question why, out of 47 counties, if you look at the VNR report for 2024, only 17 counties developed the VNR report. Why? Because there is an issue in collecting the data. But if you looked at the report further, you find that we as Kenyans, we are reporting against 168 indicators against 248 indicators. Out of 168 indicators, 19 indicators could not be reported due to data unavailability. So data is an issue in our country. Where is the problem coming from? If data was available in Kenya, we could not have been solving the food insecurity in Turkana up to this moment. Then where are these resources going to? Why are we still addressing the issue of teenage pregnancy? Is data not increasing or improving? Like in Homa Bay, teenage pregnancy is a daily thematic area. Is it for resource mobilization? In quotes, we must ask ourselves. The number of HIV prevalence is still increasing. Does it mean we're misinterpreting data? The number of youths in the country is stagnating. We don't know the exact one. Same to the number of persons with disability. We cannot know the exact data. So we have to look on how we generated this data so that they can be used in the resource mobilization. Finally, as much as we are expressing the implementation of SDGs, these counties, majority of them, 90% do not have SDGs handbooks. Then when they're developing their reporting tools, where do they rely, or where do they have the references? So these are the hard realities we have in terms of the data. And finally, we should ask our organizations, our partners, civil societies, how do they measure data? In terms of, what is the measurement of data when it comes to SDGs? Yeah. So there have been a lot of issues. So I think even this year's team has come at the right time, where now we can strengthen our democratic governance to address all these issues so that we can achieve SDGs. Thank you.
As we look forward to welcome our guest who has just joined us, I'd like Elijah for you to let us know, how do we then enhance or translate these alternative sources of data to be able to use them in helping us to track where we are with SDGs and where we should go, the direction we should take. And also, probably you can give us your recommendation on what you think we should do for us to be able to have a system where this data is stored, even if it's in alternative modes of storage.
The biggest challenge that we have, as my friend here has outlined, is the fact that we really don't have one single source of truth. And why we don't have a single source of truth is because we are using very old school ways of collecting data. It really beats logic that in 2024, we still, or rather in 2025, we still have counties who do not have, they haven't implemented any system that they use in whatever they do. So they are still very manual, they still post notices. Their procurement is still in papers. So how then would you be able to have enough data to make any decisions?
The partnerships we have between civil society, government, how can we strengthen those partnerships for us to be able to even have a central source of data?
Thank you very much. Hello everyone, my name is Ngatia Muhoya. I started a company called Millennial Speak, which is a digital public participation platform that connects young people and decision makers across the board. The way that I think we can strengthen the bond between civil society and government especially is through technology. Because technology is the greatest equalizer across all demographics, across all age groups, across all ethnicities. Whether you're in one corner of Kenya or the other, you can have access to internet, you can have access to a mobile phone, be it a smartphone or a kabambe. And that allows you to actively participate either through SMS, USSD, or even internet websites or connection. And so I believe that technology would be the main way that we can strengthen this. To give some highlights, at Badiliko, which is the platform we've created an omni-channel approach where young people can register. It's not a political party, it's a public participation platform. Young people register, they're able to meaningfully contribute either through WhatsApp, USSD, SMS. We ask them questions, they vote on issues, they have a notice board where they can get access to information, whether government, county government or national government is having a public participation event, they are actually able to find out where it is, how they can participate and engage at that level. Yeah.
Any questions? Any questions from the panel?
So how do you ensure that people will be confident to give you the information? Because if the process of data collection
2 seconds,
is wrong,
please,
then everything else will crumble. Thank you.
Thank you.
What are we trying to do to bridge that gap between the illiteracy levels about SDG goals among Kenyans, among the common mwananchi? Because you can't tell me that a common mama mboga knows all the 17 goals. So what are you trying to do about that?
So how do you encourage, inspire confidence in people whenever they notice a disparity in what data KNBS is mentioning and the policies being implemented? I'll use an example. When KNBS says something like 93% of home ownership in Kenya is by own built, then we see policies coming up in which we are being pushed for affordable housing in terms of buying them. How do we inspire confidence so that we know that our data and what our feedback is actually valuable and it's actually being implemented? Thank you.
Okay.
Let's start with the disparities first. Every county, even the national government, they have adopted what you call the program-based budget, isn't it? The program-based budget follows the same pathway on reporting of the SDGs, where we have the outputs, inputs, resources even attached to. Now, why is it very difficult from these program-based budgets for the county government to report the real data? Because there's something we are not trying to talk to us here. Now, when it comes to the county handbook for the SDGs, you'll find, as we have said, only minimal counties have partnered with the Kenya Statistical Bureau at least to develop the handbooks. Most of these counties, even at the national level, we don't know what we are reporting it and the kind of data that we need. For example, you will find most of these counties, they are currently constructing the ECD classrooms, isn't it? What are they reporting against? Is it the improvement in literacy level or the number of ECD classrooms constructed? Where are we? Those are the questions which you should be asking for. Now, that's why we are saying it is very, very much important as civil societies and individuals at least to advocate for the counties to have the county statistical abstract that cannot give you disparities and can give you leeways on how to interpret the data. Thank you so much.
Yeah, we have those institutions that collects data, and sometimes their data is public, like KNBS. Most of their data is public. You can access this. You just need to visit their website and maybe register with them for you to have access to that particular data, which is open. And also sometimes, some institutions also do collect data, and sometimes when you do make a formal request to them, especially those who are in the research field, those students who are doing research, and maybe they want to access data, and sometimes maybe when you write directly to those institutions, you are likely to get a response on how you can access that particular data. Even Kipra also sometimes also collects their data, which they use it to make some informed policy decision to support in terms of making informed policy decision by the government. And so sometimes when you write to them, they may be able to help you in how to access that data. In terms of knowledge about SDGs, I think that's the role of the government to ensure that the population is aware about the SDGs. And that is in terms of, I know when we were when we started implementing the SDGs, there was that aspect of communication. I think the government did a job to ensure that the people are aware about the SDGs. I think maybe what could be lacking is the follow-up communication on terms of achievement. Where are we in terms of attaining these particular SDGs? I think the government can do more in terms of bring up to speed in terms of communication to the public. How far are we in terms of the achievement? Thank you.
Why should I give out my data? So we have a Data Protection Act for 2019. You don't have to give out your data, especially personal identifiable information. Information that's medical information that can be used to identify you. You don't have to give out that information because it's personal information and it should remain confidential. However, if you're asked about data that can be used to develop your country, data that can be used to develop your ward, your constituency, your county, please provide that data, because that data would be useful in decision making and overall well-being of the country. Another person asked about what would really inspire confidence for us to be able to provide data. Yet there is a lot of disparity in this data. So you go to KNBS, they have totally different data as to what the president is reading out on a national event day, or the data that you're getting out of the media. One thing I would assure you people is that you need to know who is the data owner for every data that you are using. For instance, I wouldn't trust a media house on how many houses has been constructed over the Ministry of Housing and Planning. Why? Because that is the source of data. So let us learn to know who is the data owner, who is the data subject, so that we rely on that data. One thing I would assure you, there'll always be contrary information out there, but use the original source of data. Thank you.
If you look at our economy, we're very much a government-led spending economy, meaning the government is the biggest spender in this economy. And if you look at, as opposed to private sector, but if you look at more developed countries, the private sector ends up being 70, almost 80% of GDP. Here it's the opposite. Government is 70 and private sector is about 30. Where am I going with this? I'm trying to say that data is the missing link, because research and development budgets as a percentage of GDP in developing countries like Kenya is about 2 to 3%, meaning that we spend about 2 to 3% of our annual budgets on R&D. This R&D produces very minimal data. We have very little data sources. We have very little national-wide surveys being conducted in comparison to developed countries. And so ideally, we need to create a more enabling environment for research and development to take place, for solutions to emerge, not just in public sector, but in private sector.
I'd like to close it up at this point. And if you have any further questions, comments, our panelists are still here. Please reach out to them and have a conversation with them. Thank you so much. I'll give it over to Ruth right now.